All right, so how does a pathologist determine where a cancer comes from in the body? And if that cancer moves to another site, why don't we call it, for instance, if it moves from the endometrium to the lung, why don't we say that they have endometrial and lung? Let me explain this. So this really gets at the heart of what we do in surgical pathology for cancer cases. And it's the difference of cancer in the lung versus cancer of the lung, cancer in the bladder versus cancer of the bladder, cancer in the brain versus cancer of the brain. So how do we tell? Well, just like if you saw me on the street and I saw you, we look different. We're completely different genetically. And we see our neighbors and we see even our kids. Everybody looks different, and that's how it is with tumors. There are hundreds of types of malignant tumors, and they all look different. And that's why pathologists have to be really good at distinguishing those. So when I see a colon cancer in the colon, it's very easy. It's very often an adenocarcinoma of the colon, but it has distinctive features that make us think that it's colon. So if I see that same appearance in the liver, I'm going to say that is a metastatic carcinoma of the colon to the liver. Now, usually we have to confirm these things with tests called immunohistochemistry, which are special markers which show us the origin of the tumor, because all cancerous tumors have a different cell of origin. And it's very important to make this distinction when you're a pathologist because it's going to determine treatment. The difference between two different primary tumors and one primary tumor and a metastasis of that tumor to another organ. So it'll make complete difference in the treatment and the prognosis for the patient. And this is what I really enjoyed about surgical pathology. This was my favorite thing, was to be a medical detective and figure out where that cancer is from. But yeah, when somebody has metastatic cancer in multiple organs, we don't say that they have cancer of each one of those organs. It's the primary site with the metastasis to the secondary site.